Hi, and welcome to Mbuya Nyamkuta Glass Table Talk. Today I'm recording this session on my own. Mbuya Tari is away on holiday somewhere. So today this topic, I'm going to do it on my own. I'm going to talk about gestational diabetes following our program on the pathophysiologies of the third trimester. First of all, let's understand what diabetes is. Diabetes, as we all know, some call it sugar diabetes. I don't know how the sugar got into it, but it's called diabetes mellitus. It is a serious condition where your blood glucose levels are too high. It can happen when your body doesn't produce enough insulin, or the insulin it's producing is not effective, or when your body does not produce any insulin at all. That is what we call type 1 diabetic, which people can be diagnosed with from a very early age, some from infancy, and type 2 diabetes, which can come later on in life, and some of it is attributed to lifestyle. And then we've got what we call gestational diabetes. Gestational means during pregnancy. Gestational diabetes is diabetes that develops during pregnancy. It affects women who haven't been affected by diabetes before, or those women who've been affected by diabetes before. Whether you're type 1 or type 2 diabetic, in pregnancy we call it gestational diabetes. It means you have high blood sugar levels, and you might need to take medication, alter your diet, or you might need even to go on insulin. Why do women develop gestational diabetes in pregnancy? Like we always say, pregnancy is a closed book. We really don't know, but most of it is attributed to the placental hormones. And usually once that baby is born, the symptoms go. Let's go down to the risk, why some women are more predisposed to gestational diabetes. Women who are a little bit overweight, being overweight already predisposes you to even type 2 diabetes, which I'm not going to go much deeper into that because it's not within the scope of this discussion. Number 2, previous gestational diabetes. If you've had gestational diabetes before in another pregnancy, you are more at risk of developing diabetes in the subsequent pregnancies. If you've had a previously large baby, it could have been that you slipped through the net, that baby was affected by the gestational diabetes that might not have been diagnosed. Family history of diabetes and family history of gestational diabetes can also predispose you to gestational diabetes. We are not being racial here, but Afro-Caribbeans and Asian descent are known to be more prone to developing gestational diabetes, so much so that here in the UK, women are offered what we call a glucose tolerance test between 24 weeks and 28 weeks, just to rule it out. Moving on to the symptoms of gestational diabetes. Gestational diabetes is characterized sometimes, but not all. Increased thirst. You want to drink a lot. Because you're drinking a lot, you pee a lot. You're ever so tired all the time. You feel very fatigued. You've got some blurred vision. Sometimes there is nausea and vomiting. All those things could be signs and symptoms of gestational diabetes. However, the fatigue, nausea and vomiting, sometimes blurred vision, can be symptoms of other things, or they can be a symptom of just pregnancy, especially the nausea and vomiting. We always associate nausea and vomiting with pregnancy, so it could be part of that. So it's very important when you give your doctor this cluster of symptoms that you are really breaking it down, so that they can work out what tests you need and where to send you next. Okay. Gestational diabetes also, if left untreated, can lead to a higher risk of developing high blood pressure. It can also lead to a higher risk of type 2 diabetic later in life. Another risk factor of another complication of gestational diabetes usually is what we call a macrosomic baby. A macrosomic baby basically is a big baby. It's a big baby, and the baby gets bigger because of the influx of a high level of blood sugar levels, which are not really well maintained and managed in the mother's blood levels, so that predisposes the baby to become bigger. We love big babies, but big babies are not the easiest to deliver. It can lead to complications like birth injuries to the baby as well as the mother. It can lead to what we call shoulder dystocia, because the baby is quite big and they carry their feet around the top of their body. They can also suffer from, during delivery, what we call a shoulder dystocia, where the shoulders get stuck between the mother's symphysis pubis bone. The child also can suffer from low blood sugar after delivery, because it's been used to high blood sugar levels in pregnancy, and suddenly they plummet because they don't have that constant supply of the blood sugars which were coming from the mom. And it can also lead to obesity later in life for the baby. So as we can see, it sounds like something that just goes with pregnancy, but it can have far-reaching consequences later in life. The diagnosis of gestational diabetes, like I mentioned earlier, is between 24 to 28 weeks of pregnancy. Normally, different places have got different ways of screening for gestational diabetes. Here in the UK, at the booking visit, a woman normally has it's not a fasting glucose, it's a random blood sugar that is done just to form a baseline. Sometimes during that one, the sugar levels might be seen to be too high and the woman is called back in. But normally, between 24 to 28 weeks, a woman is offered what is an oral glucose tolerance test, where you fast for a number of hours, usually overnight. You come to the hospital clinic in the morning, you have a blood sugar taken, you're given either a sugary drink. Then 2 hours later, they take the doctors and midwives, they take another set of bloods. Then those will be compared between the fasting glucose and the postprandial one, the one that you take after the blood that is taken after taking the glucose loaded drink. So those will then be used to diagnose whether you've got high blood sugar or not. I'm not going to give values because values differ from country to country, and from probably trust to trust, values differ. But once your doctor has seen the levels that they are higher than what is their normal lab values, they'll call you in, they'll let you know, they'll probably want to do further tests, and they are the best people to work with on how to manage your diabetes. Most of the times it's diet controlled, and you really have to be strict with yourself and to stick to your diet, so that your sugar levels are very controlled. Your glycemic control is very good. So you might find you are discouraged from taking sugary drinks, sweets, and things like that. it's only for a short space of time. And besides, too much sugar in the diet is one of the leading causes to obesity anyway. So it would be best to listen to your doctor about what to take, what not to take, and follow that strict regime. You might need to be monitoring your blood sugars regularly, which means sometimes having to prick your fingers and taking your blood sugars at certain times of the day, before a meal, after a meal, following a meal plan, engaging in physical exercises and activity, taking insulin or any other medication that is prescribed. So it is important that if you feel any of the symptoms that we've mentioned before, it would be worth mentioning to your doctor. And also, when you go for usually for your antenatal classes or antenatal clinic visits, you find that the nurses, normally the nurses, doctors and midwives, they ask you to bring a sample of urine. They'll dip that urine. They are looking for so many things like infection. They are looking for high glucose in the urine. They are also looking at things like protein that can be one of the symptoms of high blood pressure. So you'd find that whenever you go for an antenatal clinic visit, you're asked to bring a urine sample. It's part of the screening of all those things in pregnancy. So if you have got any questions about gestational diabetes, there is so many resources that are online. Just Google gestational diabetes. If you want to ask us questions, please feel free to ask us questions about gestational diabetes. Thank you very much.